Reno. You can check them out online. It's a biointegrative health clinic. So today, I want to ask about just kind of CoQ10 and ATP. I think that's adrenal triphosphate. Correct me if I'm wrong, but CoQ10, a question I have is, how does that affect metabolism? Does it affect your metabolism? How does it relate?
Well, first of all, thank you, Steve, for having me again. And the thing here is CoQ10 is something that we have been using a lot here in the clinic. And the curiosity of people is just rising about this and what the capabilities of this specific supplement is. So metabolism, let me define that for you. Metabolism is the biochemical changes in living cells where energy is provided for vital processes. So it's almost everything that we do, we need metabolism as part of it. And what we call the powerhouse of the cell, or the factory that creates energy, is what we call the mitochondria inside the cell. And we have so much abundance of mitochondria in every cell, especially the heart. As you know, it's very active. The brain, all of these creates energy for us to be active, to do our functions. And ATP is being formed in the mitochondria. So this is the product of that factory, of that powerhouse. And it is transferred outside, out of the cell to be used by other cells as well. And what powers ATP creation? Most of the time, you hear about glucose, insulin, and even the electrolyte potassium. And why you're going to be hearing me pertaining more about the heart, because the heart is one of the biggest users of ATP and also has an abundant amount of mitochondria to do its function for our everyday. And CoQ10 is, as to define that, it's a lipid-soluble antioxidant, and it plays a vital role in cellular ATP production or energy production. I will expand on that more in a little bit.
Okay, so what does the function of ATP? It has to do with energy, right?
Yes, and that's, I want you to think of that as, yes, the battery. It's the one that gives the spark to our every function, and it's the use of it is in every cell. That's why, let's go to the basic example of the heart. But every organ uses ATP. Every event of the heart, as it pumps, as it contracts, directly or indirectly, ATP is involved with it. And the function of ATP is usually, as we know, the cell, we have cell membranes, and we pump in electrolytes, we pump out waste products, electrical changes happens in the cell so that it can produce the energy that we need. Calcium needs to get in there. All of those processes, ATP needs to be involved. And as I mentioned to you, the heart muscle, or the function of the heart, is the one that's really standing out. When I told you about contraction, about filling, all of these, the heart cells needs ATP to grow, repair, and even survive. And even outside of the heart, ATP is being used by protein synthesis or making proteins, and even other molecules that we have in our system.
Okay, so CoQ10, that's what coenzyme Q10, is that right?
That's correct.
What? Tell me more about that. What is it?
So CoQ10 is something that we hear a lot when we buy supplements. And this is, I mean, we buy stuff. Sometimes we don't even know what we're taking, but hey, it's good. I heard it from my neighbor. I'll take it. Or that ad was pretty good and impressive. I'll buy one of those. But the thing here is we need to understand what we are taking in. So CoQ10 is actually in the cellular wall of the mitochondria. And the mitochondria, as I told you, is the one that creates the energy for us. It's a vital part of that process of the mitochondria to create energy. And there are two forms. One is reduced and one is oxidized. So when you talk about reduced CoQ10, this is what we call ubiquinol. And when you talk about oxidized CoQ10, this is ubiquinone. And those two things are actually the one that confuses everybody, because you buy supplements in the store and you don't know what you're getting. But ubiquinone is the one that is out there and is the most common. And every organ, so let me tell you what specific or organs that actually benefits from CoQ10: heart, kidneys, liver, even your skeletal muscles. All of these transpires towards energy transfer of a molecule. It's also an antioxidant. It's also anti-inflammatory, and also it just is being used by the cell membrane that we always use every day.
Okay, so is there problems that can occur if we don't have enough CoQ10 in our bodies? Does our body manufacture it? Do we need to ingest it?
Right.
What can be the problems if we're lacking it?
So the deficiency in CoQ10 leads to the theme that I want you to always remember about CoQ10 is it improves cellular energy production, and it supports the function of that specific organ. So for the heart, the pumping and the relaxation and the distribution of blood. So the heart is actually more of in when we talk about cardiovascular illnesses, this is something that's related to heart attacks, congestive heart failure, the heart that's starved with energy, and also atrial fibrillation, the funny heartbeats of the heart, and cholesterol issues, diabetes, and even hypertension. If you're lacking in that, you're very prone to these specific illnesses that I just mentioned.
So if CoQ10 is low, then those things can occur.
Yes.
Okay, so does our body make CoQ10 on its own, or do we have to put it in our body?
So the thing here is when you talk about CoQ10, there's so many different ways on how it's being given. The basic thing here is, first, you need to know what are you using it for. So cardiovascular diseases, cardiovascular effects, if somebody has like clotting issues, of course, that's definitely that is something that CoQ10 will be useful for. It also improves vascularity, the blood vessels. And when I mentioned to you about a while ago, the lipid or cholesterol problems, and also when you have blood sugars that you're having a hard time controlling, you can use that there too. And also blood pressures that are high for hypertensive patients, these are very useful. But the most common one that you will always hear when somebody is taking a cholesterol pill, when somebody takes that specific medicine, it depletes CoQ10, and that could also be related to the common side effects of these cholesterol medicines, which is muscle aches, muscle pains. Yeah, that's why CoQ10 needs to be repleted in these situations. And the thing here is, as I mentioned to you, I want to guide patients on how to take CoQ10. Ubiquinone, which is the oxidized form, is actually okay to take because ubiquinol is more expensive, and majority of the studies actually are more of ubiquinone, and thus making it effective already for a cheap price. And oral doses can be taken around 100 to 200 milligrams, especially if you have any of the diseases that I just mentioned. And CoQ10 actually has a specific brand out there. I can't mention names, but if you just if you guys just want to ask me when in person, that there's a specific CoQ10 for the heart, and as you take this, it goes there, and it's just focused for that. If you take a CoQ10 that is over the counter, this is more of CoQ10 for the general system, and that's why I advise for a patient who has a cardiovascular issue to take both, one for the heart and one for the systemic needs of the body. And other different ways, unusual ways, which we do here in the clinic, you can also get CoQ10 through IV, also intramuscular, and we give this to patients who constantly needs CoQ10, especially for the athletes or for the ones who have a heart condition such as heart failure and even post heart attack cases, wherein the the muscle of the heart is damaged.
Hmm. So, I'm in the health club business, so I know kind of about some how the body works. I studied it. And the ATP, that's energy in the cell, right? So we that's calories in our mouth is what replenishes that, right? Because if we go lift weights or we run, that's the first energy that's used, right?
Right. Well, ATP is being created. You would see this as a very complicated chemistry. That when you take in, let's say, glucose or carbohydrates, there's a process that it goes through, and it's being broken down, and it breaks down into what we call glucose turns into pyruvate. And as the process goes through, as they break, the body breaks down glucose, ATP is being created already. That's why you feel a little stronger when you put food in your system, like
Right.
especially carbs. It's because of that. It's feeding now the mitochondria. I mean, it's feeding every cell with ATP, and also it's getting used by the mitochondria and other cells also.
Right. So it can take energy from like fat cells and transfer it to ATP, put it in a muscle cell, right?
Correct.
Okay, well, I think you may have answered some of my other questions, like how CoQ10, do we just take it orally? You said that you can do it intravenously for people who have maybe heart problems, or are those the two main ways? I mean, I figure orally is how most people take it.
Oral is the most common, and oral is the most practical way of taking it. You don't have to be in a doctor's office. You don't have to get poked. But again, as I always mentioned, the most potent is through intravenous or, of course, intramuscular.
So, last question. It's what interests me is you talked about CoQ10 is specifically more beneficial to the heart, where the other one is more for general, for maybe the kidneys and the liver and so on. So is there anything else you wanted to go over with maybe about the uses of CoQ10, if there's specific ones for the heart or and some for the kidneys? Is there anything
Well,
to
yeah,
expand on that?
the difference of those two is people think that when they take CoQ10, it's just for the whole system. It's just that when, for example, we have patients who had a history of a heart attack or somebody who has heart failure, that heart needs more of that CoQ10. So if you take a CoQ10, a general CoQ10, you put it in your system, it gets redistributed everywhere. But you want it to be focused on the heart. With that special CoQ10 that I'm mentioning, it has this formulation that it has an affinity for the heart muscle. That's why it's basically focusing more on building that ATP production of the mitochondria specifically for the heart. And that's why when you're taking that, you have to make sure you take an extra CoQ10 also for the systemic needs, the kidneys, the liver, the lungs, because everything is just going towards the heart and you're neglecting the other areas too. So you're hitting two birds there with that specific approach.
And the body, I can't remember, did you say the body can produce its own CoQ10?
Yes, we can. We can produce our own. It's basically it's being produced in the heart, kidneys, liver, and even the muscle. But as we age, and also as oxidative stress from the food that we eat, the exposures that we have around us, everything gets depleted. That's why eventually we would need supplementation.
Hmm. Wow, great topic, Doctor. Appreciate your wealth of information. That's Dr. Nario at Biointegrative Health Center in Reno, Nevada. You can look him up online. Thank you, Doctor.
Thanks, Steve.